Hello, today we're going to be doing an assessment on a baby that has been brought in for a 1-month checkup. I've asked the mother to get the baby in to a dry diaper, and she has. I walked in the room, mother's holding baby, so we put the baby up here on the table, and I'm assessing the overall look of this baby, looking at the bruising, if there's any bruising, or if there's any lesions, any rashes, or anything like that. Everything seems to be normal about this baby. First, what I want to do while the baby is calm, I want to listen to breath sounds. To listen to, or to count breath sounds, I apologize. And to do so, I want to put my hand lightly here on the abdomen area. Most babies will breathe, and you can count that by their abdominal area. Also, while I'm doing that, I want to make sure that there's no nasal flaring, no retraction in the chest area. Retraction means they would suck in, you could see the ribs, things like that. So I'm going to lightly put my hand on here while the baby's really calm. I'm going to count this for 1 minute. A lot of times a baby will breathe several times, maybe take a pause, breathe again, another pause. So that's why we do this for 1 minute. All right, I've done that for 1 minute, so I want to record that. Now I want to listen to the baby's heart rate, and to do so, I would use a pediatric stethoscope, by the way. I want to come down to the 4th intercostal space, 3, 4, and we can listen right there. Again, we want to listen for 1 minute while the baby's calm. All right, I've done that now for 1 minute. We're going to record that. Didn't hear any murmurs or anything like that. I'm going to take the baby's temperature. All of my stuff is sanitized prior to walking in and assessing this baby. I'm going to put a sheath over our temperature probe here. You want to put it in the underneath the arm pit, in the innermost part of the arm there, the deepest part of the crease. Hold the arm to the side until the machine beeps. Okay, great. 98.7. That's good. While I'm here, I'm going to go ahead and check pupil reaction for this baby. Most babies won't follow a light, but you can check pupil reaction, the best you can. This being a 1-month-old. Next, I want to check the circumference of the head, the chest, and the abdominal area. And to do so, what I want to do is use the centimeter side. For the head, what I want to do is go to the back of the head and come around the temple area, and we'll measure that. We'll raise my baby up. We're going to slide this underneath him. We're going to check the chest area, right underneath the armpits, across the nipples, and we'll record that. Abdominal area, we want to do that at the biggest part of the abdominal area there. All right, we're going to record that. Also, while I'm right here, I want to check the skin turgor of this patient, make sure the baby's not dehydrated. And to do so, you just kind of pinch up a little bit on the chest area there, and make sure that they're not dehydrated or anything like that. I would check the nose, mouth, eyes, ears, things like that. Make sure that nothing's out of ordinary. I'm going to ask mom if the baby's having how many dirty diapers, how many wet diapers in a 24-hour period. I'm going to ask her, is there any foul odor to that diaper, which may indicate some type of an infection. I want to ask, the stool, are they hard, soft, liquid, what color they are, that kind of thing. I want to turn the baby around. I want to check reflexes, and to check reflexes, you can take your fingers, and most babies at this age, you can put your fingers on the inside of their hands, in the palm of their hands, and they'll grasp for you. Make sure that they do that, symmetrically. You also can check the reflexes, of the feet by pushing in, kind of tickling or pushing in on the plantar area of their foot. They'll kind of extend or retract that there. The overall appearance again of this baby is a good appearance. I'm going to weigh this baby, and to weigh this baby, I would have my scales here with me. We're going to measure in kilograms, and I'm going to zero that out. I'm going to lay the baby on there with a dry diaper. We're going to record that. Now I want to measure the baby, and to do so, there's a couple ways. You can you can hold the baby's head still and take your pen and mark here. You can also pull the leg down, extend that out, mark here, measure then. Or you can get a measuring board. Most doctors' offices have measuring boards, things like that. So you put the measuring board in there and you put the baby's head up against the board, extending this foot all the way out as far as, it will extend, and you measure using that. I'm gonna ask the mom, if the baby's having any nausea, vomiting, any diarrhea, anything like that, anything of her concern that we need to know, maybe we can bring to the doctor's attention prior to going into the room. Also, this baby, if this baby was breastfeeding, I'm gonna ask mom, is the baby latching on, making sure that the baby's getting enough nutrition. We can tell that also by the weight of the baby. Not only are we going to ask about the baby, we want to ask about mom. Is there any concern she has? Is mom doing okay? Dad, whoever brings in the baby, we want to ask them those questions. For overall, this baby with measurements and stuff, he's in about a 90th percentile. This baby's growing very well for 1 month old. Again, I would ask any concerns from the parents or the caregiver, whoever brought the baby in. At this time, I would give the baby back to mom, dad, whoever brought it in, and we're going to go get the doctor and let them come in.